Good evening, and thanks so much for joining us for MiWeek. I'm Christy McDonald. Big news across the state this week. Medicaid expansion in Lansing. Finally a plan to expand it, but it is far from perfect. Also coming up tonight, $100 million heading to neighborhoods in 5 cities across Michigan. We're going to show you how it's supposed to help out. Plus, there are billboards, radio ads, you name it. Districts statewide are still trying to sell themselves days before school starts. How effective are these campaigns? Lawsuit alert, yet another legal challenge in the mess that is the Detroit mayoral election, and why Grand Rapids' thriving airport means bigger things to come. But we start tonight with Medicaid expansion. Close to 500,000 more low-income people in Michigan will be eligible for health insurance coverage thanks to a close vote in the state Senate. That's the good news. Bad news, it doesn't take effect until months after the January deadline for the insurance mandate, and the state could be losing millions of dollars. Let's bring in our MiWeek contributors and the editorial page editors of the Detroit News and Detroit Free Press, Nolan Finley and Stephen Henderson. How are you, gentlemen? It's good to see you.
Very good.
Good All right. It's been a busy week, and so I guess let's jump right in with Medicaid expansion. Good news that it finally got done. We've been talking about this for a number of months, but again, this is not going to go into effect until April.
Well, it's not, and I think that's going to be the wrangling over the next little bit, whether to give it immediate effect. Legislature should give it immediate effect. It'll create less problems for the state, save the state some money. It's inevitable now. It's passed. The opponents can't derail Obamacare, and they're not going to derail Healthy Michigan. They need to just get it done. But this was a really big win for Governor Snyder. All summer we've had pundits questioning the governor's political skills.
You just hooked a thumb over towards Stephen's way.
Oh, the governor can't control his Republican caucus, blah, blah, blah. This guy has not lost a thing on his agenda so far. I mean, sometimes he has to take a rocky path to get there. But this was a big win for him because it holds together, I think, or at least allows him to appeal to that those moderate independents and Democrats who gave him his victory last time. And this gives him something he can sell to them.
All right, so what does he get out of this, Stephen? And does he gather back some of those moderates, independents?
Oh, I think he might. I think Nolan's right. It's a big win for the governor. It took him a while to get there.
Have you changed your mind about his leadership a little bit?
No, I mean, I still think there's stuff on his agenda that's not done. He had a very successful first 2 years with the legislature. This year has been much tougher. This has not been as productive a session. There's stuff still out there that we can't get through on, and so this is the real test for him. But this was a big win, and it will appeal to Democrats and independents who he needs desperately next year because he's got to run for re-election.
But he got such a remarkable amount of things done in the first 2 years.
Well, he did, no question.
He said himself after those first 2 years that there's not that many things left to do.
Well, see, but
the
I
challenge
disagree
now
with
is
that.
implementation.
Well, I disagree with that.
Well, what's left to do?
Well, I mean, refinancing of schools, higher ed, boost early ed, refinancing of
wait a
cities.
Minute now. Early ed got $45 million in the last
half
budget.
of what it was supposed to get. Again, it's the settling for less than what we need.
And those sound a little bit more like things on your agenda than maybe on the governor's agenda.
Well,
these are not things the governor put forward as his
I'm the one who gets to say what the agenda should be.
All right, so wait a minute. Let's circle back around a little bit to Medicaid, though. And though this did get done, it is far from perfect. What kind of funding could we be missing out on now, Stephen, because this isn't going to be going into effect until April? And can there be room for change? Can we change that so people can actually get on, so they don't have to continue to pay for their insurance before they're eligible for it?
Here's one of the real frustrating parts of this issue is that everyone wants to talk about it in terms of funding or money or cost. The cost is what we're incurring now with 470,000 people who have no insurance, who we pay for every time they show up in the emergency room with a hangnail, and it's triple what it should be. So what we really need to focus on is how soon can we get those 470,000 people onto the insurance rolls so we start saving that money. Now, the federal government's going to pay for this, at least for the first, I think it's 3 years or 4 years of the health reform. The quicker we get that in place, the quicker we start making that money or getting that money from the government. And every day that we don't have it, we're subsidizing the other states that do have it. And that's one of the big problems in Michigan, too, is that it's a big donor state.
One of the big questions here is whether the federal government's going to be ready to go ahead in January with Obamacare, and there's no guarantee of that. This thing is a mess, and I think states that are
this part of it is not in question.
States that are questioning the effectiveness and the appropriateness of Obamacare are urging, including Michigan, I think Governor Snyder are urging the administration to look at maybe some alternatives of what's working, but places
Sure.
like Rhode Island,
Sure.
liberal Democratic state that put in a whole different style Medicaid program and actually cut their costs. And the problem is Washington is so entrenched. It's either all Obamacare or no Obamacare.
Well, that's because of the
and
Republican position.
Oh, it's also
That's
because
absolutely
the
because of the
Democratic
Republican
position, the
position.
no compromise position. They see any effort to change Obamacare, to alter it to meet some of these concerns.
That's actually not true.
As
You talk to-
as a concession that they did the wrong thing in the first place, which they did.
I think also that we're finally getting the conversation that people are starting to understand that they have to start to prepare for this. There's going to be a lot of conversations in the next 2 months now that this is coming. Are people educated about it and what they need to do for it and be prepared?
Well, no, of course not, because they don't know what it's going to look like. We've already delayed the employer mandate, so employers have no idea what to expect. Most of the rules still
Well, they
aren't
know what to
written.
expect because they delayed it. I mean, they said we're not doing it. So
Up
that
the
was
road,
the
though,
that was the
they
expectation.
said they're not doing it for now.
Right.
But up the road, they still don't know what the rules are going to be.
Okay.
So you still have people making investing and hiring decisions.
No question.
Based on a law they don't understand yet.
Stephen, last word.
You know, again, every major social reform that's been accomplished by the federal government in this country has suffered this kind of attack. Social Security, Medicare and Medicaid. In the end, they all moved us forward. They all were huge social changes. This was no different. Republicans will squawk about it. It's going to make 50 years from now, no one will ever question the wisdom of this.
We can all agree there's going to be some growing pains. All right, moving on. Just hours before counting the last ballots in the Detroit mayoral primary, state workers were told to stop. On Thursday, someone filed a lawsuit challenging the Board of State Canvassers' authority to certify the Detroit election, and an Ingham County judge put a stop to the count. So is there validity to this argument, or is this just another embarrassment that we are almost a month after a primary election and we do not have a certified result?
Of course, it's another embarrassment. No, there's no validity. Detroit's an entity of the state. Of course, the state has the right to certify the election. Who else was going to sort this mess out? And this wasn't just someone who filed the lawsuit. This was the opponent of Janice Winfrey in the clerk's race, Will Coxon, who has an interest in this. And why in the world the Ingham County Circuit Court would inject itself into this yet again is beyond me. They had to see this as a frivolous lawsuit.
Yeah. When I saw this headline come across yesterday, I said, really?
Well, I mean, you have this sort of running issue right now in Detroit, which is if you can't win at the ballot box, you win in the courthouse. And that happens over and over with things that should be settled, that somebody says, well, no, I'm going to go to court and raise a frivolous issue. And in this case, it really is, and delay the outcome of what voters want. There are huge problems with this lawsuit. One is the idea that somehow the state has no right to go into ballot boxes and count votes, which is laid out explicitly in state law. That's the process, in fact, for disputed counts is to go in
goes to the state.
and take a look. But there's also this sort of running narrative of this idea of sovereign cities. In other words, that the city is its own place and we manage our own affairs and the state has to stay out of it. That doesn't exist either in our Constitution or in statute in the state. People have got to understand cities are creations of the state in Michigan, and we govern according to state law, not according to local whim. And the more we sort of argue over this stuff, I think the harder it gets to battle that sort of cultural problem that we have, which is that people believe we're somehow independent from the state of Michigan, and we're not.
And the Ingham County Court has set itself up sort of as the opposition government in Michigan and has allowed Robert Davis to make that court sort of his.
Robert
he
Davis, a
owns
union
that-
activist who has followed a lot of lawsuits.
The AFSCME guy who, sort of owns that court. And, something has to change in that regard. You can't have these two-bit judges in a circuit court undermining government, stalling government across the spectrum.
I mean, local elections take place in Michigan at the behest of the legislature and the Constitution and the statutes that we have. They are not things that we invent for ourselves. This all happens under the rubric of state law, which is the governing principle, and we just got to understand that and stop fighting about all this other stuff.
Hearing on Tuesday, and hopefully we'll start to get those vote tallies sometime soon.